Okay, so this is assisting with a thoracentesis skill 13.7. I'm going to move the video camera around a little bit here, okay? This is an assisting, okay? So we're going to be helping the doctor with this procedure. And so first thing we want to do is we want to gather our supplies, okay? And so what supplies are you going to need? Well, first of all, you're going to need a sterile kit, okay? So depending on whatever the procedure is, you're going to need that kit. So this one is a thoracentesis. So you're going to need a sterile thoracentesis kit, okay? It's going to kind of look like that over there. We'll look at it closer here in a minute. But each facility has a different supplier, so each one is different, okay? All right, and then the physician's going to need a sterile gown, okay? And you are both probably going to need a mask, as well as you may need the hat, the bouffant cap to put on for yourself and the physician. Now, depending on the facility policy, your patient may also need to wear a mask and the bouffant hair net cap, okay? All right, so that's gathering our equipment. Oh, yeah, wait a minute. I forgot about a really important thing, and that would be sterile gloves. So the physician's going to need sterile gloves, so I would grab like 2 or 3 pairs of those for the physician. I usually generally will grab 1 or 2 pairs for myself as well. I don't use them generally, but it's always good to have them on hand just in case you need to put on some sterile gloves, okay? So there's that. Now we've gathered our supplies and our equipment, and we perform wipes, and now we're going to explain to the patient that it's really, really important that they don't cough during this procedure, because the physician's going to be sticking a needle into their chest wall and drawing off fluid from the pleural cavity around in the chest, around the lungs. So it's really important that they don't cough, because we don't want to puncture a lung, okay? All right, so we've explained that to the patient, and then we've also positioned the patient for ease of accomplishing this skill. And the easiest way to do it is the tripod position. Now, mind you, you can have them sitting on one side with their arm forward and elevated, okay? So they could be leaning against the head of the bed with an arm up and them leaning to one side, either right or left, depending on which lung it is that they need to remove the fluid from. But the easiest position would be the tripod position. And as I have positioned this mannequin on the bed, okay, as you can see there, I have them sitting with their feet dangling, okay? I have their arms on a pillow on the overbed table, okay? And I have the patients leaning slightly forward, okay? So this is what we call a tripod position. And this is a very good position for accomplishing this this skill. As you can see, I have the back open, okay, for the physician to be able to accomplish this. Now, you may need to have the gown completely off the whole back, so leaning towards the front of the patient or onto the pillow, okay? So now I'm going to pause it for just a moment and position the camera. All right, so now we're going to assist the physician with so that he or she can set up their sterile field. And like I showed you in the other video, you do assist in this process. Now, the physician may need help with tying on the gown, the sterile gown. It depends on the physician how they handle that. So just be prepared that you may have to assist with tying on that gown, okay? And you have to be very careful not to touch the outside of the gown. All right, so that's a whole other ball game. And I'll have a gown for you to practice with when you come into the skills lab, okay? Okay, so the next thing you're going to assist with is opening up the sterile kit. And again, what you're going to do is you're going to pull the paper, and it's going to pull towards you so that the sterile kit is toward the physician, okay? So you can be holding it like this, pull the paper back. The physician will lift the sterile kit up and out of the container. I've done it numerous times, so it's not working very well. And they will put it onto their table, okay? Now, prior to this happening, you should wipe off or cavi wipe or sanitize this table, so this table is the cleanest possible surface for them to set up their sterile field, okay? The physician will then open up their kit. You will not be doing this, the physician will. I just need to get to a certain thing. So I'm going to pause this for a moment, and I'll be right back. Okay, so the physician has opened up the kit and has now draped the patient for this procedure. And as you can see, like I told you in the other video, they will drape a wide area. This is now, this whole blue area is now the sterile field, okay? So touching this is not good. That breaks the sterile field, and you know, that's just not good. They will have cleaned this whole area with the ChloraPrep prior to putting the drape on. So this whole area will be sterile as well. As you can see, this is the area that they're going to actually puncture for the thoracentesis, okay? All right. So what is your role during this whole procedure when the physician is puncturing and getting the fluid off of the patient, okay? Your role is to assist the physician as needed. So getting supplies, assisting if they were to get a hole in their glove, whatnot, whatever the physician needed, okay? You're going to maintain strict sterile technique, and you're going to make sure that the physician follows that as well. If they break sterility, you need to stop the procedure. Okay, that is important. It's very, very important. Okay, and as with any invasive procedure now, we have what we call a timeout procedure, and that is that literally you say timeout, and both you and the physician verify that it is the patient. And you use the two identifiers, right, which is the patient's name and date of birth. And the patient can actually participate in this, right, because they could tell you. Okay, then you're also going to verify that the procedure that you're doing. So this would be a thoracentesis, okay, and you would verify which side, right or left. So for this particular one, this would be left, right? Left, correct? Okay, so for this one, this timeout would be for Grace Collins, date of birth January 14th, 1969. Medical record number is BF8901. She has no known drug allergies. We will be performing a left thoracentesis, and you would verify that, both of you, okay? So that is a timeout. There's a form that needs to be completed with times, and you both will be signing it, okay? All right. So you're going to also then support and monitor the client. How do you do that? You're going to support them verbally, describing what is happening. Tell them right before the physician punctures their skin with the needle to put the lidocaine in. Okay, Miss Collins or Grace, the physician's going to be putting in a numbing agent right now. It's just going to help take away some of that pain. I know there's a little bit of pain right now, pinching, a little bit of burning, but it'll feel much better in just a moment, okay? And then every time that they go to do something, explain what they're doing, okay? Whether they're using the scalpel to open up the skin a little bit so that they can insert the needle better. Whether they are, oh, look, we're getting fluid, we're collecting some to send to the lab right now. Oh, yes, you're doing lovely. Okay, you're also going to be observing them for signs and symptoms of distress. So dyspnea, pallor, coughing. We don't want them coughing, remember? So you're going to be assessing their vital signs, assessing their color, assessing their anxiety level, okay? You're going to collect drainage in laboratory specimens. So the physician has most of the collection devices within this kit. They may also need what we call a vacuum bottle, okay? And the vacuum bottle is going to look something like this bottle here, but it's going to be bigger, okay? And it's not going to have any liquid in it. And what happens is that when the physician punctures it with the needle that'll be on this, okay, they would puncture the bottle with this tubing that's connected to the patient. It would then drain the vacuum in the bottle, because it's a vacuum bottle, would suck that fluid right out of the patient, okay? So you may need, 3 or 4 bottles depending on how much fluid is in the patient, okay? And then you're going to make sure that the puncture site is covered with a small sterile dressing, okay? So that is what you do for a patient during the procedure. What do you do for the patient after a thoracentesis? Well, we're going to monitor them, okay? We're going to assess them. That's what we do. That's what nurses do, right? We assess. So we're going to assess their pulse, their respiratory rate, their skin color. Anything that's going to tell us, oh, Lord, they're not doing very well. Or, oh, Lord, they're doing really well, right? So, because remember, with the thoracentesis, they have fluid that's built up in that pleural cavity around the lungs. And that fluid is taking up space that normally the lungs would use to expand and get air into, okay? So when they have the fluid in their body, they're going to feel short of breath, okay? When we start draining the liquid, it's like relief to them. It's like they can finally take a full breath. Their color changes. They feel wonderful when we start taking that fluid off of there. You'll see when you do the first one. You will see, okay? We're gonna monitor for changes in cough, sputum, depth of respirations, breath sounds. We're gonna monitor if they start complaining of chest pain. That's not a good thing. We don't want that to happen, right? Okay. We're going to position the client per our hospital policies, generally side lying on the unaffected side with the head of the bed raised 30 degrees for at least 30 minutes after the procedure is good, okay? Also sitting up in the tripod position for at least 30 minutes afterwards is also good. Why? Because we want those lungs to continue to reinflate. Remember, they've been in a constricted environment, okay, and the tendency would be to deflate quickly, as well as we don't know if there's going to be some blood that's developing in there from the procedure. We don't know if we punctured a lung. So having them sitting up so that we can assess that way, the way that they are, is the best way, okay? All right, so we're going to dispose of supplies in the appropriate container. And so with, I'm going to turn this now, okay? I'm going to turn this and down to the kit, okay? Physicians should, and I'm going to tell you, should take all of their sharps and put it within this container right here, okay? They should. If they don't, tell them to. Okay, it's their responsibility to make sure that the sharps are taken care of, that nobody gets hurt, okay? Some physicians will even take the sharps and put them right in the sharps container themselves. Yay for them, okay? But if not, they should at least have them in that holder, okay? And then you take all of the sharps and put them in the sharps container, okay? And that includes the scalpel. That is also a sharps. That goes in the sharps container. Okay, so stand up for yourself, be an advocate, make sure that the physicians do their job as well. You're going to discard your gloves, perform hand hygiene. You're going to return the bed to the lowest height, because remember, we may have raised the height of the bed up to the physician's level because we don't want them bending over for the procedure. It's bad enough that they have to lean across the bed in order to do this, because remember, we have the patient sitting on that side of the bed and we're behind the patient. So we literally have to bend over this bed. You see that? Can you see that bed that we have to bend over? That's a lot of bed that we have to bend over, okay? So the position that the physician's in can hurt their back. So we want to make sure that at least the bed height is up, okay? We're going to document all relevant information, including the client's response and the client's record. The physician will chart how much fluid they've taken off. We should know that for all intensive purposes for I&O, right? Because it was output from the patient, yes? We probably are going to monitor their weight, because their weight might probably fluctuated when we took that fluid off. Okay, and then we're also going to transport the specimens to the laboratory. Some facilities will have a pneumatic system, meaning that a tube system that they can tube specimens down to the lab. These glass bottles don't tube very well, so they literally have to be brought down to the lab, okay? So that is skill 13.7, assisting with a thoracentesis.